Hi, my name is Chris Permasio. I'm the director of the International Surf Therapy Organization. Today, we are so excited to be talking about the scoping review in the Global Journal Community Psychology Practice. We've got Elizabeth Benninger, a passionate community psychologist with a strong background in community mental promotion. She completed her MA in psychology with a specialization in community psychology at Antioch University in Los Angeles, and her doctoral degree in psychology from the University of Western Cape in Cape Town, South Africa. She is the founding director of Muizenberg Beach Club, a nonprofit organization focused on children and youth activities connected to nature, including surfing, snorkeling, hiking, camping in South Africa. She's also former director, co-director of Ways for Change, and the founder of the organization's therapeutic surfing program in Cape Town. Welcome, Elizabeth. We have Dr. Gregor Sarkisian, a professor of psychology at Antioch University in Los Angeles. In 2015, Dr. Sarkisian began a partnership with the Jimmy Miller Memorial Foundation that provides surf therapy to youth at promise, veterans, and active duty military service members. Dr. Sarkisian has been an active member of the International Surf Therapy Organization since 2018, and more recently, an advisor to our board. Gregor was also our fearless leader and guest editor in publishing the first of its kind special focus issue on surf therapy around the globe in the Global Journal of Community Psychology Practice. Hi, Gregor. We also have Chloe Curtis, a research and evaluation team coordinator for the Jimmy Miller Memorial Foundation. She earned her BA in marketing and MA in education from Loyola Marymount University. She's now working on her second master's in mental health counseling at Loyola Marymount while coaching the Division I men's and women's cross country and track teams. Ultimately, Chloe plans to earn a PhD in sports psychology. Chloe discovered surf therapy by volunteering as a surf instructor with JMMF for the first time in 2017. And since then, she's assisted Dr. Sarkisian with everything from data collection to report writing for the foundation. Welcome, everybody, and thanks for being here. Gregor.
All right. So thank you for joining us, and thank you, Chris, for the introductions. So when I joined ISTO in 2018, there wasn't a whole lot of collective research. It was really sparse. It was hard to find. Publications existed, but they were in all these different journals. And one of the board members, Jimmy Marshall, he had like a working literature review or like a working reference list of all the articles he came across. And so when we came up with the idea for the special issue, we really wanted to make the research more accessible. And so by doing this literature review, it provided that first step in that direction. And we thought it was important as well to kind of put out there a beginning definition of surf therapy. And we wanted to make it purposefully broad so that we didn't exclude programs that might be doing something different. Like, for example, right now, there's surf therapy going on in a wave pool in the UK. And Kristen Walter in San Diego is looking at the benefits of surf therapy compared to hiking therapy. So we don't really know yet what is the impact of the ocean in surf therapy, and we should learn more about that soon. But to start off, I worked with the board in 2019 to come up with a beginning definition. So it's kind of like throwing a net out there. We don't know what we're going to get, so we're going to make it a broad net, and then we'll tighten it up as the research helps us understand the benefits of surf therapy. So the definition, surf therapy is a method of intervention that combines surf instruction and surfing and structured individual and or group activities to promote psychological, physical, and psychosocial well-being. So again, this is a very broad definition, but the purpose is let's include as much as we can, and as we learn more, we can narrow down that definition. And actually, it's a scoping review, not an empirical literature review, and I'm going to pass it on to Elizabeth to talk a little more about How do we distinguish between those?
Sure. So when we were designing the study, the definition was a great starting point for us to think through the scope of what this review was going to look like. So initially, we wanted to do a systematic review, but because of the broad nature of surf therapy and even doing some preliminary searches to see what kind of research was out there, and with all of us having experience in the sector, it was really difficult to narrow it down to very specific research questions that are typical in a systematic review. And we also knew that we wouldn't have the evidence out there to really synthesize the data from these various findings since they were so diverse. So we knew there were some studies on like the impact of surf therapy for children with autism spectrum disorder, and also with children in foster care, as well as military veterans. And so it's really not possible to bring all that diverse data together in the form of a systematic review. So we decided on a scoping review because where we're at in the field was to really try and understand the scope of research that's out there on surf therapy with this broad definition. And so a scoping review and a systematic review, they're very similar in that they are rigorous. They provide very transparent ways of searching for information, and they try and include all studies that are relevant to the research questions. So we created our search criteria. We created our research questions, which was broadly looking at what was available, what evidence was out there, and synthesizing the evidence on surf therapy, and what the implications were for surf therapy research and for practice. And so we created our key terms, and you can see all the details to this in the Global Journal publication if you're curious of how this was done. And then we decided on the databases. So we decided to use metadatabases for this. A lot of times systematic reviews might use databases relevant to the field. So if we, for example, just wanted to know about the benefits of surf therapy on depression, we might use a database that's more focused on psychology. But because this is so broad, we really looked into these metadatabases like Google Scholar, EBSCOhost, and Wiley. And so we split up the team, and each of us took a lead on searching one of the metadatabases using this very systematic search criteria. And then a second person also replicated the search to make sure that we didn't miss any articles. And then we also looked at the references of any of the studies that we found and looked up those articles. If it seemed like in the title it was relevant to surf therapy. Another difference with the scoping review is that we didn't use an appraisal tool. So an appraisal tool, you typically, you're looking at like the rigor of the studies or the quality of the studies. For this review, we weren't really concerned with the quality of the study design. We included master's theses and doctoral dissertations. And so we really just wanted to get an understanding of how is surf therapy being used, who's researching it, and what are they researching so that we could use it for maybe even more focused research questions in the future, but also just to inform what's happening in the field of surf therapy and to get a better understanding of what's going on. So that was really our process with designing the scoping review and kind of going about the methods. And now I don't know if Chloe, Gregor, if you have anything to add about the process. If not, we can start talking a little bit more about the findings.
I think you got it covered.
Yeah. So I'll move on to talking a little bit about some of the findings and the learning. So we found that surf therapy, as a part of the methodology, we created charts that really took out data from the different studies to describe what was being measured, what populations were being served, what changes they were looking for, if there were any significant outcomes. So one of the categories in our table was the populations. So as we discuss the findings, we're going to kind of break them out by populations. And I think there's a lot that can be done to further develop surf therapy based on the focus of the population. So the first one I'm going to talk about is the one that I have the most experience with in practice, programs serving children and youth, specifically those in need of some kind of social and emotional support. So there were a number of studies based on these programs, and we broadly named the category children and youth in need of social and emotional support. We also spoke about this group as challenge adverse populations, but we didn't really like the label too much. So another term that's commonly used is youth at promise. But in all of the articles, really different terms were used to describe these groups, from youth at risk of isolation, foster care youth, youth with a history of abuse and neglect, youth exposed to violence. So we kind of grouped all of the studies looking at youth in that way. And we found that all of the studies reported on some benefits to social improvements in social and emotional well-being through participation in the surf therapy programs. It was difficult to really synthesize all the findings together because most of the studies had totally different ways of measuring things, from using more standardized measures to qualitative methodologies such as interviews and focus groups, to creating their own measures, trying to understand what's happening. But some of the areas where improvements were reported were on things such as improvements in their interpersonal relationships, improvements in emotional regulation and coping, positive outlook, positive effect, and feeling of sense of mastery, feeling improvements in self-concept or self-esteem and confidence, and then along with physical benefits. So those are some of the things that we discovered about this population. And if Chloe, you can add to that, or you can tell us a little bit more about what we learned about youth and children with disabilities.
Sure, yeah, I think I'll move on to youth with disabilities. So there were 7 studies in this category. This was one of the most represented categories, but this encompasses all different types of disabilities. So it could be physical disabilities, youth on the autism spectrum, intellectual and learning disabilities. So it's a really wide range. And we know that in general, children with disabilities tend to have lower fitness levels than their peers, and also fewer opportunities to be part of group activities. So the studies in this category focused on both of those aspects, and just with surf therapy as a physical activity, but also the social pieces that it brings, just being a part of a group. The studies focused on both of those 2 aspects. So one study showed that after 8 weeks of surf therapy with a group of a wide range of disabilities, so this one had autism, Down syndrome, physical disabilities, and learning disabilities represented, that whole group significantly improved their upper body strength, their core strength, and their endurance. So that one was only focused on the physical aspects of surf therapy. The rest of the studies in this category were mostly focused on youth on the autism spectrum. And these ones used qualitative interviews mostly to measure the benefits. So parents reported increases in confidence, increases in social skills, and improvements in their behavior. And also it helped to reduce anxiety, and which led to better sleep, which is huge for a parent of a child with disabilities. And then also a lot of parents commented on just the sensory inputs that surfing provides. So everything from the waves crashing, just the tightness of a wetsuit on the body of a child who's on the autism spectrum, that can have a really calming effect. And then lastly, they also commented on just surfing as a normalizing activity for their kids. Surfing is kind of a cool thing to do. So it created this normalizing opportunity and an opportunity for the families to come together and bond.
I think that's a really important one because a lot of it is about identity development. And so if you have autism, a lot of your life is like, no, and you have to be doing something a certain way. But these youth felt like, oh, wow, I'm a surfer and I'm part of a surfing community. And so I think that's really important in terms of identity development as well.
Yeah, and I would say across the studies with children and youth, there was a lot that came up about identity development, and all of the studies that at least were seeking to measure this reported this improvement in like the social connectedness that they gained through surfing and being a part of that surf community. So that was a really cool finding, I think, and really important when it comes to surf therapy practice and designing more of these programs.
Awesome. So next we had active duty military service members as another category. So there were 3 studies in this one. One was a case study, and this one only had 1 participant, but it explored using surf therapy as an alternative form of pain management. So that's something that none of the other studies really focused on, so that was interesting. And then the most significant findings in this area came from Kristen Walter and her co-authors, who they had a study with 74 participants, and they showed that after 6 weeks of surf therapy, negative affect, symptoms of depression, anxiety, and PTSD symptoms all decreased and positive affect improved. With this one, you have to keep in mind that about 3/4 of the participants were receiving some other type of treatment. So that could be physical therapy, psychotherapy, or medication management. But just to see all of those areas significantly improve was really powerful. And these results, combined with everything else we've learned from studying other populations, have led to the development of the first randomized control trial with a similar population. So that's a big step up for surf therapy in general, and so we're excited to see that. So this is also going to be by Kristen Walter and some co-authors, and they'll look at active duty military with major depressive disorder and compare surf therapy as an intervention versus hike therapy. So finally we're getting a comparison group, and we're kind of advancing the sophistication of our research with that one. So we're really excited to see the results there. Does anybody want to comment on that?
No, I think
Sure.
Go ahead.
Oh, Gregor.
Go ahead, Elizabeth.
No, I was going to say she covered what I had to say.
I was going to just say, well, like there's in terms of like building an evidence base, something I think we really learned from this was that a lot of the studies were observational or descriptive, meaning there is really no manipulation of treatment. And so it makes it more difficult to make a conclusion about, was it the surf therapy or something else that created the difference? And so there's a few experimental studies going on now, and that's really important in terms of building the evidence base. And I think that's, so the scoping review kind of like is pushing all this evidence we have so far forward and kind of highlighting where the areas where we need to grow.
Mm-hmm. Right, and also just to add to that, more research can help answer the questions on sort of the delivery of surf therapy, and is it meant to be a standalone intervention, and as a standalone intervention, can it have the same benefits as if it's coupled with other forms of more traditional therapy like psychotherapy? And I think it's great either way. So maybe in some cases it works great as a standalone intervention, but maybe in others the best outcomes will come with surfing while also going to these more traditional therapies like psychotherapy, physical therapy as well. So we're in the right direction of trying to answer some of those questions, but in the scoping review, there was limited evidence to really be able to jump to those conclusions.
Yeah, there's
Is it okay if I interject? Because I learned this from Gregor a long time ago as a complementary, right, to other pieces of sort of the puzzle that goes together. But I say this often, I quote you often, Gregor, is what we can say is that whatever ails you, if you go surfing, you're going to feel a little better. Now, we don't know if that's directly, in correlation with all of the other factors that are in your life. But I really love that idea, because it's like either way, you're going to feel a little bit better. So I think that that's really cool to add that, complementary methodology of surfing. So yeah, very cool.
awesome. So next we have veterans. So there were 5 studies in this category, and most of them reported that surf therapy provided respite from symptoms of PTSD. So veterans in all the studies described that since surfing really demands your complete focus and all your attention on getting into the wave, riding the wave, even just getting out past the waves, you really have to focus on the present moment. So that gives them just a break from their symptoms of PTSD, and it really does fade into the background. And then some veterans also reported that by stringing together consistent periods of surfing, they were better able to manage their PTSD symptoms in general, not just during one session getting that break, but being able to better manage them over time. And other results included just decreased stress levels, decreased depressive symptoms, and use of narcotics, and then also increases in feelings of self-efficacy, so feeling like you can take on a challenge. That's all I had for that one. Anyone want to comment on veterans?
No, but I think, well, yes, I guess you brought up a good point about the stringing together those sessions and some of the implications for programs, especially some of them that are once off or over a certain period of time. If there's ways we can, even if the program has less structure, but to continue to provide access to surfing for those populations, because it might, with post-traumatic stress disorder and a lot of other mental illnesses and mental health challenges that people face, it's maintenance more than it's just, okay, I surf for a few weeks and now I'm recovered. And so how can we find ways to continue that support through surfing so that it's not beyond the intervention? And I would say that applies for the programs targeting children as well. Both the children who were in need of that extra social emotional support. What happens when you create this system of social support for this 3-month period, 6-month period, whatever it is, 2-day period, and then you take that away? Are these children better off? Do they have access to continue to surf? Do they have access to that network? Or where are they now? And there's very little longitudinal evidence to support that, but it's something we really have to think about when we're designing these programs. If one of the main benefits is that community and that support and that connection with the waves, are we creating programs that allow people to continue once the program's over? And then you really have to think about like socioeconomic situation of these participants and their access to the beach and things like that. So I think that's a really important finding and something that really wasn't discussed much in the studies that we found.
Yeah, veterans, as you know, are active duty military. They come from these battalions. That's all they know, are a brotherhood or a sisterhood. And so when that is taken away from them upon retirement, so many of the veterans, I know Gregor certainly, and Chloe and myself with the veterans, I could give you 100 stories, but I remember one of my favorite veterans, she kept talking about how, okay, the ocean could kill her and she overcame it. So now she can go make a really difficult phone call that she has been putting off quite literally for years. And that transition and sort of translation of, I've overcome this, and now what else can I overcome, is just so impactful. And some of that is absolutely that community that, you know, builds her up and cheers her on. Gregor was, I think, one of the most valuable surf instructors I've seen, specifically with our veterans, because he just was so in tune with each and every one of them. And they would like quite literally request Gregor. So I just remember those days. But anyway, sorry, I'm so excited about this subject. I keep chiming in. My apologies. This is your guys' deal.
And there are programs that, there were a couple of studies that mentioned how they try to do this with one program working with children with disabilities. They teach the parents how to surf, and they give the family a surfboard. And so with part of the idea of sustainability, like that those kids and those parents can continue to go out and surf and practice these skills even beyond the program. And one spoke about how they developed like a surf club. So maybe they're in this more structured program, and then the youth can continue to come to this club and continue to surf and stay connected in that way. So there were a couple of examples that could really help guide us, other programs, when they're thinking through these type of things.
Yeah. All right, so next I'll move on to young adult cancer survivors. So this one's really specific. So there was actually only one study in this category, but this one looked at the impact of surf therapy on body image, self-esteem, and self-compassion for young adult cancer survivors. And all of those areas improved. And results also included a decrease in depressive symptoms and feelings of alienation. So you can imagine for a young person going through cancer, they probably don't have a lot of people in their life who are their age going through the same thing. So surf therapy can be really powerful for them in a lot of ways as well. So yeah, I'll hand it off to Elizabeth for the next.
Yeah, and the last category that we had was adults recovering from addiction. And just like the cancer survivor category, there was only one study, and it was a phenomenological qualitative study. So it was really concerned with the in-depth experiences of individuals who were in recovery, who were receiving some sort of formal mental health treatment coupled with surfing. And it's a very promising study about the experience of there was a limited number of individuals, but they experienced a mindful embodiment was one of the key findings of that study. So that connection with yourself and the ocean, feelings of self-empowerment and attachment, secure attachment, and also talked about a lot of the benefits of surfing as a spiritual experience, which spirituality can be very helpful for people recovering in recovery or struggling with addiction. So there's a lot of really powerful implications of this study. However, because it's just one study and it's qualitative and it has a very limited sample size, it's hard to generalize it to like the larger population of people in recovery. But it still provides a very, very valuable information. And we're also very aware that there are a number of programs, surf therapy programs working with this population. So there's really a gap and a need there to study the benefits for that population further. So that's another implication from what we learned from this study. I think now we were just going to speak a little bit about, what we learned related to some of the gaps that we've kind of discussed along the way, but also what some of the future directions are for surf therapy research and practice. So we can start with Gregor, and Chloe and I can add in from there.
All right, great. I think there's really, in my mind, I see three big takeaways from the scoping review. First is what Elizabeth was talking about earlier. Each surf therapy program kind of develops its methodology of intervention based on the population or the needs of the population. And so I think that's really important as we go into the future and thinking about how do we organize ourselves in ISTO and how do we kind of like push the field further. I think being population focused and having researchers and practitioners involved is going to be a really important next step in better understanding what are the benefits of surf therapy. Because it is like a universal intervention, like Chris was saying before. It doesn't matter what ails you, you go surfing, you're going to feel better. But what that looks like differs depending on if you're a child with autism or a veteran with PTSD. The second takeaway is that research in surf therapy is kind of in its infancy. If we think about like a ladder going from observational designs to experimental designs and how do we develop that evidence base? Well, we need more experimental research. But what we did learn is that across the board, almost all results, in fact, all results were very positive. So benefits are being observed, but in terms of how do we distinguish what's the cause and effect, that's where we're at our infancy in terms of research. But across the board, everyone who's going surfing in these surf therapy programs is receiving a benefit from that. And third, I think the scoping review and the special issue on surf therapy overall provides a framework for the sector to build an evidence base. So by an evidence base, not only is it like we can read about what's going on and what other programs are doing, but there's all these measures available now. And so as we start to begin to share measures, and it's easier now for programs to adopt a standardized measure, we'll start using similar measures and start looking at benefits across programs. And that will also help build the evidence base. So that's kind of what I see as the three takeaways. What else do you see?
In addition to those, I think what really stood out in the studies that we found is that there were two different kind of overarching frameworks of surf therapy. There was the clinical frame on the one hand, and then there was the health promotion frame. So there are a lot of programs out there that are doing surf therapy developed by trained clinicians who are applying their clinical practice to the ocean and to the waves. And then there are people doing surf therapy out there from a health promotion lens, which is really about creating this environment or this opportunity for participants to cope better and to be healthy and to be well. And by promoting that through surfing, they're also seeing these benefits or these outcomes similar to what clinicians would see when it comes to like improving symptoms of depression or post-traumatic stress, things like that. And so I don't think it ever has to be one or the other. I think there's a lot of room in the field for it to remain broad because it's benefiting everybody who's in it. I mean, from what most of us know who have been out there in the ocean trying to facilitate surf therapy in any way, you can just see that there are so many benefits. But whether or not it has to actually be led by a clinical professional or a community member really just varies on what the focus of your program is and what your population is. So that's something that really stood out. And I hope that I know sometimes it feels like a tension, but I think they really complement each other really well, just like medicine and public health do. Public health needs medicine, needs the physicians, and the physicians need the public health practitioners. So surf therapy can benefit from the diversity that we're seeing. Something else that sort of building off of that, from the studies kind of that are taking this health promotion frame, there's a lot more that I think needs to be measured when it comes to understanding health promotion. So if you're really trying to develop a program that promotes the health and well-being of participants, you need to pay particular attention to the social, cultural, and historical context. I don't think we mentioned it too much yet, but the studies we found were from a diversity of countries from around the world. So serving very diverse populations, and populations that represent diversity that surfing hadn't historically seen in the past, where in many cultures it was viewed to be this sport of privilege connected to white culture in certain areas. And now in these studies, that was not what was represented. There were very diverse samples of participants, but very little attention actually paid to the social, cultural, and historical context. So thinking about, if we're an intervention that's aimed at promoting health, how are we working within that context to ensure long-term health outcomes? Because I think that's what we want. We don't just want a kid feeling better tomorrow because they surfed. We want to actually create some kind of social transformation, which if you go surfing in the waves of South Africa, you start to see. Because when I first started surfing there, when I was 19 years old, the ocean was white surfers and it was dominantly male. If you go surfing out there today, you see Black surfers, you see surfers who identify as colored in South African context, you see Indian surfers, you see tons of females. So the field is really diversifying, and I think a lot of that has to actually do with some of these surf therapy interventions. So paying attention to this and measuring it would also be really beneficial. Anything else to add, Chloe?
Well, can I add really quick to that, Elizabeth? I think what's also what I have experienced through reading the scoping review article and all the rest is some research on volunteers, because that includes that social dynamic and that community base. You look at a lot of these programs across the globe, and honestly, for some people, this is the volunteers, this is their entire social life, is waiting for these sessions to happen often weekly here in Southern California, but across the board, they literally, and I can give you many examples, as soon as the organization puts out their calendar, they input those into their own individual calendar. And these are the volunteers. So that's such a big piece to me in the research that I haven't seen. We haven't even developed sort of that questionnaire yet, but yeah, we need to research the volunteers. So many of them would say to me, gosh, this was my therapy today. And I'm thinking, how come you're not taking the survey? So yeah, to add to that.
Right, we didn't see any studies that looked at the volunteers or the benefits or the impact that they were having specifically to the volunteers. So that's a really good point as well. But what we did see, kind of building off of that, was that so many studies focused on identity, but mostly looking at self-esteem, which is sort of like more about like the individual, but not looking at like what we know about identity, especially in like psychology and social psychology, is that it's influenced a lot by other factors, like the way you're experiencing your environment and the way you're being treated and the access to resources that you have and the color of your skin and discrimination and all these other factors. And there was very little attention paid to how these other factors of being the only female surfer maybe out there, or the only Black surfer out there with all these all white volunteers, team of volunteers, like how is that having any kind of influence too on the outcomes and the experience? And especially because we had such diverse samples. So it would just be very interesting to look into that further and for programs to really take that into account. If you're working, I know in California, we have a long way to go in seeing diversity in the ocean. And a lot of these programs were serving youth from various racial backgrounds, a lot of them from low socioeconomic status, who are not going to continue to have access to the waves, to the beach, to the surfboard outside of that program. So we need to address that in this field in order to sustain those long-term health outcomes.
And I think there's, a lot of opportunity there to develop, maybe surf therapy programs that are integrated into school systems where,
Right.
Like kids learn how to surf in middle school and they become surf mentors in high school, and, kind of like incorporating it into, school systems
Right.
and communities.
Which is happening.
Yeah,
You
it's
know,
happening. For example, that's part of the model that we had at Waves for Change when I was the co-director. We trained community youth who had been denied access to the ocean historically. They were from Black and colored communities in South Africa. Colored is a racial identification in the South African context. And we trained some of the first generations of youth of color who were surfers, and they became the mentors and the facilitators of the surf therapy program. So not only did they get training in how to surf, they got training on how to promote mental, physical, and emotional well-being within their communities. And they connected with the kids in their communities in a way that I never could as a white female American from a totally different and much more privileged background with much more access to sports like surfing growing up, even though I learned in South Africa, but I did snowboarding and other sports like that than they had. So I think that model was really effective, but we didn't really, it hasn't really been researched well. And so that didn't come up in the literature.
Yeah, I would just add that, you know, like Gregor said, surf therapy research is still in its infancy. So just being able to bring everything together in the scoping review and create this snapshot of where we're at, and then adding everything new from the special issue is a really good place to start. Like for me, I'm a student, I'm still kind of developing my research chops, and I know tons of people come to Chris, or maybe like if you run your own program and you're just getting into developing a study to measure your benefits, this would be a really good place to start to see where we're at now and what measures other people have used, and you know, what people are looking for. So that was kind of the goal, just to see where we're at and where we can go forward. Obviously there's a lot more we need to explore, but it's a good start.
And Chris, isn't there a research resource available through ISTO for programs? What is that about?
yeah, so our evaluation framework, you know, that really came out of the global journal, really kind of raised the bar in research. We had initially back in late 2017, early 2018, come up with this very simple survey. The idea behind it was to get people really used to collecting data, any kind of data, because by and large, a majority of the programs were not collecting any. So we really wanted them to get into the habit of it. And then you rock stars came up with this global journal, this special issue, and now people want to raise the bar in that. So through the International Surf Therapy Organization, we are sharing wildly an evaluation framework that includes 11 different actually validated measures that people can use. And yeah, so you know, we too want to raise the bar in building the evidence base, and that's kind of really why we exist, isn't it? So why ISTO exists. You know, we've got all the programs, organizations doing their thing down on the beach, and we're trying to bring everybody together and continue to build that evidence base. So even on our website now, we have obviously all the links to the bibliography, which has continued to grow, and then the special issue. I have a question. You know, you mentioned you included theses and dissertations, and that you had a criteria when collecting these articles. I'm wondering, were there any that didn't meet criteria? Like, were there any papers you guys came across and it was maybe too much of a case study? Nothing wrong with case studies. Those kind of, you know, hit us on our hearts, but it just didn't meet what you guys were looking for as far as standards.
For this, there were some that didn't meet what we were looking for, not because of standards, but because of the scope, that it wasn't really looking to measure surf therapy. So there was, maybe Gregor can help me with some of the specific ones. We did decide not to include a couple, but not because of the rigor. So I will say that there were a few studies that I read that, and maybe part of it, like the theses, where it was like, oh, well, this is not really scientific, you know, the rigor isn't necessarily strong enough to meet like a scientific publication. But for this, we had a number of conversations, and we said, you know, really, we just want to get out there the scope of what's being measured and studied in surf therapy, because we don't really have enough to pull it all together and say, this is what's working and this is what's not working. But there were a couple studies, one that was focused more on the ocean, the therapeutic benefits of the ocean, and not specific to surfing. And then we had a study about supping, and I think we chose not to include that as well, because we said we're gonna, for this, we're looking at surfing. So if there was something about surfing on Lake Erie, we would have included it, but this was about stand-up paddleboarding, which is different. But there were a few like that just weren't quite in, didn't quite meet what we were looking, our research questions.
Yeah, I wouldn't add anything to that. That's totally accurate, you know. And so, but part of defining it so broadly is that we've created the open space for supping to possibly be in there, right? So it's, but in this first round, we want to keep it specific to surfing. Not necessarily, you know, supping on a lake is not necessarily surfing. So, but it could be in the future.
Right. And for those of us who do both, like me, because I'm based on a lake now, there's a lot of similarities in the benefits, and then there's a lot missing too. There's certain connection, certain things about connecting with the ocean and the waves, and kind of that adrenaline rush that you don't get from supping, but the mindfulness-based benefits, I think you would see across. So it would make for really interesting future research too, kind of like the study that's looking at hiking. I feel like when I go hiking, I experience a lot of the benefits as surfing, but then there's also more, there's something unique about surfing that can't compare to anything else I've ever done. And so what is that thing? And can we measure that? And is there room for future research in that area too?
Yeah, that this was such an incredible conversation, because the truth is, I'm always referring to Gregor. I quote Gregor and everything. This really is the beginning, and what an exciting time to be alive. What an exciting time to start to get to see the growth. I mean, there's, you know, no question, decades and decades of research on the benefits of being in nature and being physically active. So the idea of putting it together, and Elizabeth, you're absolutely right. All of us surfers are a little biased. There's something so extraordinarily special about being in the ocean and riding the waves, you know, and being just a part of that experience. So we'll put our fingers on it. We're working towards that. I can't thank you enough. I don't want to cut you short. Were there any other things that we missed? This was such an engaging, obviously I chimed in and this was not my panel. I apologize. So this is so exciting. I've become like a research nerd and I love it. It's, you know, it's fascinating to me. I read the Global Journal twice, and then looked at all the videos later. It's really exciting to be a part of. So thank you so much for all of your work going into this, because the other thing I'd like to mention as we talk about diversity and inclusion and equality, we are missing 3 other women who helped with the scoping review. And sorry, Gregor, you're the one person on here who admittedly said, I'm a little tiny piece of this. And it was all the girls that took over and did it. And, you know, to them, you know, we send our regards and thanks for their work as well. And you guys were also working all around the country. So that's an important piece of, you know, COVID or no COVID, you guys had already been doing and utilizing, you know, technology to get this done in time and get everything to Gregor in you know, to be able to get this published in April of 2020. So some really exciting and cool things happened this year. And a big piece of that was the special issue being published. So thanks so much for being a part of our day.
Yeah, thank you, Chris. And I just say, you know, the best part about the special issue is that it's a resource for all surf therapy programs. And there's so many benefits that programs can take away from it and use articles or measures or findings to promote grant writing in your programs, or building your own evidence base, collaborating with other programs serving similar populations. So it is a really exciting time, and it's just the beginning. So thank you for making the space for this, Chris.
Absolutely, and I think just like Gregor, our study really points to this need for ISTO and to keep collaborating, because now we're kind of kicking it all off, but there's so much work to be done, and we can't do it in silos. We need to work together. We need to collaborate as programs, as researchers. So I hope that this organization can continue to create that space for us to really come together and just be better and serve more people.
Love that. Thank you so much.